On our YouTube channel, you'll find a limited selection of pathology and patient videos. With Osmosis Prime, you'll get access to over 700 videos, including complete coverage of pathology and physiology, and a growing collection of pharmacology and clinical reasoning topics. Try it free today.
Tuberous sclerosis is a genetic condition that causes growths to form in various body organs. This most commonly affects the brain, skin, kidney, lungs, and eyes. Normally, there are two genes called the TSC1 and TSC2 that help control the growth and division of cells in the body. TSC1 encodes the protein hamartin, and TSC2 encodes the protein tuberin. Both of these proteins are tumor suppressors, meaning they help slow down cell growth and prevent tumors. They do this by combining to form a hamartin-tuberin protein complex which binds to and inhibits another protein called mechanistic target of rapamycin, or mTOR. mTOR activity speeds up the cell cycle and increases cell proliferation, mainly thanks to its effect on protein synthesis. So, when mTOR is switched off by the hamartin-tuberin protein complex, it slows growth and division of cells throughout the body. Individuals with tuberous sclerosis have a mutation in either the gene TSC1 or TSC2, and these mutations have an autosomal dominant inheritance pattern. The mutations lead to an altered hamartin-tuberin protein complex that's unable to switch off mTOR. Because of that, benign tumors and growths called hamartomas form throughout the body. Hamartomas are kind of like tumors, but they're made up of a variety of cell types from the tissue where they arise, rather than a single cell type. In fact, if we think of the tissue like a sheet of fabric, a hamartoma is like a knot in the sheet. Benign tumors and hamartomas can form in any tissue, but the brain and the skin are usually affected the most, along with the kidneys, lungs, and eyes. On top of that, the lifetime risk of cancer is increased in individuals with tuberous sclerosis. That's because the rapidly dividing cells can develop additional mutations that eventually make these growths expand beyond the basement membrane and invade neighboring tissues. In the brain, the most common growths are glioneural hamartomas, also known as cortical tubers. They arise from supportive glial cells as well as neurons. Next most common are subependymal nodules, which are hamartomas that form under the ependyma, the thin membrane that lines the ventricles in the brain. Individuals are also at an increased risk of developing a subependymal giant cell astrocytoma, or SEGA, which is a type of cancer that can arise from the subependymal nodules. On the skin, many small growths called angiofibromas appear on the face. Individuals also have many small bumps called fibromas under the nails, known as subungual fibromas. Light, flat patches also appear on the trunk called ash leaf spots, and a distinctive dark, raised patch on the forehead is a common feature. Another classical feature is a shea-green patch, which is a large, elevated skin-colored patch that often appears on the lower back. Individuals with tuberous sclerosis can develop renal tumors called angiomyolipomas. Although benign, they can get really big and put pressure on the kidney. Because the kidney has a lot of blood vessels, angiomyolipomas do as well, and they can bleed spontaneously. Individuals can also have lymphangioliomyomatosis in the lungs, which are cysts where the normal lung tissue is gradually replaced by cysts lined by endothelial cells, which are cells that normally line the blood vessels. Finally, hamartomas can also form in the retina, which is the light-sensing part of the eye. Symptoms of tuberous sclerosis are often related to the hamartomas in the brain, which cause problems like seizures, learning difficulties, and cognitive deficits. A large angiomyolipoma can cause flank pain, and lymphangioliomyomatosis in the lungs can cause shortness of breath, and retinal hamartoma can cause vision changes. Diagnosis is usually made based on the skin lesions and can be confirmed with genetic testing to identify a mutation in TSC1 or TSC2. A head CT or MRI can identify hamartomas and tumors in the brain, and is usually performed regularly to screen for new lesions. Treatment of tuberous sclerosis is focused on the symptoms. Anti-epileptics are used to control seizures. Brain tumors are managed surgically or with chemotherapy, and behavioral and developmental problems are managed through therapy and psychiatric medications. Alright, as a quick recap. Tuberous sclerosis is a multisystem autosomal dominant genetic condition caused by mutations in genes TSC1 or TSC2. The mutations lead to an altered Hamartin tuberin protein complex that's unable to switch off mTOR. It causes benign tumors and hamartomas to grow in the brain, the skin, the kidneys, the lungs, and the eyes.
Hey! Thanks so much for watching this video on tuberous sclerosis. This was kind of a short, sweet, and to the point presentation of all the pertinent information you guys need to know, like what it is, what the symptoms are, where it can show up, and how you can treat it. I had a really awesome time being a part of the creation of this video as the video editor. We also had Elizabeth, who did the illustration, Evan, who did the voiceover, Harry, who wrote the script, and then Rishi and Yifan, who edited the script. If you want to see more content like this and more in-depth videos, you can always go over to osmosis.org and check out our other videos and flashcards and other really cool content. We really appreciate your support, and I'll catch you on the next one. See ya!